Is it possible to crack FMG exam in 5 months? That is, if I start now. Of course, yes, you can crack it if you start now. I've come up with the ultimate strategy for FMG 2025 June session. So before I move into the details of this video, please check out my YouTube, Telegram, and Instagram accounts for more updated content. Now, quickly moving on to this video, FMG Ultimate Strategy 2025 for the June session. So, focus on the upcoming trending subjects like pharmacology, pathology, medicine, surgery, and dermatology, which have shown a tremendous increase in the number of questions in the recent FMG Jan session. Be cautious of the downtrending subjects like ENT and pediatrics. They have seen a slight decline in weightage. And focus on the clinical and image based questions. Prioritize the high weightage and the frequently asked topics. Moving on to the subject wise strategy. For biochemistry, biochemistry has a moderate difficult level with case based and lengthy questions. The most frequently asked topics are proteins and enzymes, consisting of 7 questions which came in the Jan session, and focus on the enzyme mechanisms and regulations under this topic. And the second highest topic is carbohydrates with 3 questions in Jan session, and the most important ones there are glycolysis, gluconeogenesis, and glycogen storage disorders. Then genetics, vitamins come each with 2 questions, and under genetics, inborn errors and molecular biology techniques needs to be checked upon. Under vitamins, the deficiency disorders and porphyria are the important topics. And from lipids, 1 question came, and that is about the cholesterol lowering agents, that is the drugs. So the strategy is focus on the high yielding metabolic pathways and the enzyme deficiencies, because that is the topic which came with highest number of questions in biochemistry. And then revise the vitamin deficiencies and porphyria, and also don't forget to solve the previous year questions. Moving on to the next subject, that is surgery. Surgery has shown an increasing trend in urology and upper GIT with a consistent focus on tumor-based and image-based questions recently. So the important topics in general surgery is the general part again, and consisting of 16 questions in the previous FMG exam. And from the general, the most important topics are wound healing, surgical infections, and fluids. And from the upper GIT tops second with 7 questions in the recent FMG exam. So from this topic, peptic ulcer disease, GERD, and esophageal varices should be studied as questions came from there. Then the third most important topic from surgery is trauma. Focus on the head injuries, fractures, and the ATLS protocol. And then urology comes again with 6 questions. From the urology part, don't forget to check out the renal stones, the prostate disorders, and the bladder carcinoma. So the strategy is prioritize tumor markers, emergency management, and surgical instruments. Focus on the high yield clinical case scenarios. For orthopedics, most important areas are the tumors and the basics. So 1 question came from here, that is about the common bone tumors and about X-ray interpretations. The second one is about the instrument, and 1 question came again. So learn about the common orthopedic surgical tools. And the trend is increasing focus on X-rays and nerve injuries recently. So the strategy to be followed is master fracture classifications, joint disorders, and nerve injuries. Moving on to the next one, pathology. For pathology, the key focus areas are the general pathology consisting of 7 questions. And the most important part here is cell injury, inflammation, and amyloidosis. Another important part in pathology is hematology and tumors, consisting of leukemias, lymphomas, and anemia, having the highest number of questions. And there is an increasing trend in clinical and image-based questions in pathology recently. And the strategy to be followed is master the histopathological slides, tumor markers, and the immunohistochemistry in the beginning. Next one, pharmacology. So again, the most tested areas are the general and ANS. So from that, 6 questions came in the recent exam. From that, don't forget to study the receptor mechanisms and autonomic pharmacology. From the endocrine part, which comes with 7 questions, diabetes is the most frequently asked topic, and the infections is the third commonly asked topic from pharmacology, and it had 3 questions in the last one. So don't forget to study the drug of choice for the common infections. And strategy is prioritize the emergency drugs, contraindications, and the side effects. Moving on to OBG, the key topic is the obstetric complications, consisting of 11 questions in the previous exam. And from that, the most important topic is preeclampsia, eclampsia, and postpartum hemorrhage. Then basic stops with 5 questions, consisting of the normal labor and the fetal monitoring. And tumors, consisting of 3 questions, stops third with ovarian and cervical carcinomas. And the strategy to be followed is focus on the emergency obstetric conditions and the contraception methods. Moving on to dermatology, which is a short subject. So the trending topics are infections consisting of 3 questions, and the most important infections to be focused are the leprosy and the TB skin manifestations. Then comes STI with 2 questions, and the topics important here is syphilis, gonorrhea, HIV, skin lesions, and again acne and hair loss is a common topic here. So don't forget to study the common dermatological disorders. Strategy to be followed is revise the clinical images and the histopathological slides so that you can get all the dermatology questions correct. Next one is pediatrics. The most important topics from here are neonatology, consisting of neonatal resuscitation, which had 2 questions, and also don't forget to study the UPCAR and immediate newborn care related questions, and also pneumonia and diarrhea and malnutrition. They consisted of 4 questions, which were the key infectious diseases. And the strategy to be followed for pediatrics is revise the growth charts, vaccine schedules, and the pediatric emergencies. Next subject, psychiatry. For psychiatry, the focus topics are psychotic disorders like schizophrenia, delusions. 2 questions came from there. And then the next important topic is mood disorders, consisting of 2 questions again. So check out depression and bipolar disorder related topics. The strategy to be followed is learn the diagnostic criteria and the first line drugs for the common psychiatric disorders. Next one is forensic medicine. So forensic medicine, the key areas is post-mortem changes, and 3 questions came from there. So don't forget to study the topics under that: rigor mortis, time since death estimation. And the second important topic in forensic is inquest and court procedures, consisting of 5 questions. That is the legal documentation. So the strategy to be followed is memorize the IPC sections, forensic evidence handling, the post-mortem changes after the time, particular time estimations, and about the inquest. That's it. And for next one, general medicine, the strategy critical area is 7 questions, consisting subject is CNS. So don't forget to check out all the important areas related to stroke, Glasgow Coma Scale scoring, and neuroimaging, and CVS, murmurs, JVP, and arrhythmias. So the CVS comes with 9 questions, which is the second top area in general medicine. Then the acid-base disorders consists of 2 questions, and don't forget to check it out again. And the strategy is master the ECG, emergency case scenarios, and system-wise medicine in the end. And moving on to ophthalmology, the high-yielding topic is refractory errors, consisting of 5 questions, and myopia, hypermetropia, and astigmatism. Don't forget to check them, which come under refractive errors. Second is traumatic ophthalmology, consisting of 4 questions. So study chemical burns and orbital fractures. The strategy to be followed is focus on the fundus findings, corneal ulcers, and the cataract surgery. Next subject, anesthesia. Key areas is basics. Basics consists of 2 questions about the types of anesthesia and the complications. And next, 1 question came from BLS and ACLS about the emergency airway management. Strategy to be followed is revise the ventilation settings and the anesthetic drugs. Next subject is anatomy, and the most tested from here is nerve and blood vessel injuries. 2 questions came from that in the previous section. Don't forget to also study about the brachial plexus and the vascular trauma as well. The strategy needed is clinical correlation and applied anatomy. So you can study surgery along with anatomy. as they are related. Next one, microbiology. Important topics. The most important one is the serological test, which had 4 questions. That is the including the ELISA, PCR, the agglutination reactions, etc. The second top